Good morning, good afternoon, good evening, colleagues. We're just going to give another couple of minutes while people begin to join the webinar, and then we will go ahead and get started. So good morning, good afternoon, good evening, colleagues, and welcome to the third webinar in the joint UNICEF RISE Institute webinar series titled From Fragmented Fields to a Unity of Effort for Early Childhood Development, the SDGs and Multisectoral ECD Data Systems. My name is Nicole Petrowski, and I'm a statistics and monitoring specialist in the data and analytics section at UNICEF headquarters in New York. And I'm part of the team that has been collaborating with the RISE Institute to bring you this webinar series. Just a quick note that we are offering simultaneous interpretation in Arabic, French, and Spanish. So you can access these different language channels using the interpretation button on the bottom of your screen. This is the third webinar in this series and the last for 2022. So we're currently working on a calendar of topics and dates to continue the series in 2023. And as we've mentioned previously, we definitely want this to be a collaborative effort. So we would welcome suggestions or proposals for topics that people may have if you would like to reach out to us and offer a suggestion for facilitating a webinar that would fit within the scope and theme of the series. This last webinar for 2022 is going to be on national multisectoral monitoring and evaluation systems for early childhood development. Next slide. So today we have the pleasure of hearing from the team at the RISE Institute. We will be hearing from Emily Vargas-Barron, who needs no introduction. She's the director of the RISE Institute. And then we will also hear from Crystal Dial, who is the deputy director at the Institute, and Carlos Del Castillo, who is a senior fellow at the Institute. And the RISE Institute works to assist countries around the world with ECD policy, planning, early intervention programming, and multisectoral ECD monitoring and evaluation systems. Next slide. So in today's webinar, there will be 3 sessions. First, there'll be a session about looking at why it's important to assist countries in preparing multisectoral ECD M&E systems. Then we'll look at integrated M&E frameworks and monitoring for ECD. And then finally, we'll look at organizational structures for M&E systems. There will be an opportunity at the end of the presentations to ask questions, but you can also use the Q&A function on your Zoom platform to also ask questions or make comments throughout the webinar as well. And we will either try to answer these directly or we'll come back to them during the Q&A session at the end. So with that, I'd like to give the floor over to Emily. Thank you.
Thank you, Nicole. It's a pleasure to be with everyone this morning, and we look forward to your comments and questions. I'm going to address the rather general topic of assisting nations to prepare multisectoral M&E systems. Why is this important? Next slide, please. The need for data is essential in developing national ECD policies, plans, and programs. And this extends also to ECI strategic plans and guidelines and procedures. So the need for data is very clear. However, it's rarely there when we want it. National and international ECD planners must hunt far and wide for data to plan effective policies, plans, laws, and costed action plans. I personally have spent days and days looking for the missing data that should be there but isn't there. And this is because I have to hunt far and wide, because it's necessary to fulfill the needs of a whole of government approach for ECD. It must be multisectoral. And that means that we have to go into many sectoral plans that are included within ECD, which are principally found in the ministries of education, ministries of health, and with nutrition under it, sometimes sanitation and water, but oftentimes water and sanitation will be in yet another policy area or sectoral area. And then social protection and child protection, which may be in two different ministries. Consequently, we end up with a great effort trying to find what indicators exist and what data. Many ECD indicators and data are usually found in those sectoral plans, and within the sectors we have what are called management information systems. Many of you are well acquainted with them, but some of you may not be. Prominently noted are the education MISs, or management information systems, and the health management information systems. We have a lot of proto systems developing up in the child welfare or social welfare, child protection, and social protection field. Some ECD indicators are not found in any sectoral plans or databases in many countries, and look as we may, we don't find them. ECD indicators and data are rarely gathered together and organized. So this becomes something that is extremely important for us as we move forward. Next slide, please. What types of national data are needed for countries to develop effective policies, plans, laws, and costed action plans? For many years, we have prepared with our colleagues in the countries where we work situation analyses, and they've been primarily based on secondary sources. Increasingly, we have become disappointed with what can be done in those situation analyses. So now we have turned to conducting primary research, both quantitative and qualitative. Under quantitative primary research, we do mapping surveys of ECD and ECI programs, surveys of ECD and or ECI directors, personnel and beneficiaries as needed. Service inputs, outputs, and outcomes are gleaned wherever we can find them. Financial support is identified by the levels of government and type of source. By levels of government, I mean the central governmental ministries and agencies. If there are budgets at the provincial level, then it will be provincial budgets that we look to. And in addition, there may be district level budgetary entities and certainly municipal budgetary entities. And we need that because we have to cost our policies. These are called costed action plans. We also try to pick up information wherever we can through very carefully constructed cost studies per child, per cohort of children going through a program, or for an entire program. And we do that for the main types of ECD services or for ECI services because you can't do every kind that exists within the country. With regard to qualitative primary research, consultation workshops are held and or focus groups. I count a lot on these because this is the voice of the people. And this is where people take ownership of the data. So it becomes extremely important to ensure that the people who need to be in those workshops are invited or in the focus groups. This will oftentimes include beneficiaries of programs, personnel of programs, and directors of programs, depending upon the need of the particular studies. And then high-level interviews are critically important to find out what people in top positions dealing with young children feel is most needed. Oftentimes, they are very well informed, and they give us excellent pointers from based on their extensive experience. Next slide, please. You will recognize on the right our 17 Sustainable Development Goals, and they have been beautifully rolled out by the UN system around the world. We find the SDGs which have, as you know, incredible metadata, indicators, and measures and targets, very well managed in many countries. They are not necessarily complete in all countries, but they are there. What we find is also with that regional initiatives now, like the PRC for ECD, which is the Pacific Regional Council for ECD, and they are building their own data set that is cross the region. So the SDGs are complemented also by important issues that have to do with the Convention on the Rights of the Child, Convention on the Rights of Persons with Disabilities. So we try to pay attention to all possible international and regional indicators. Interestingly, at the ECD policy level, in countries, we find different priorities, which is, I would say, to be expected and wanted. I was recently working in one country where the difference between the SDG list and the SDG policy of the country is great. They have different construction, although many of the same indicators are there. There are additional indicators because the country values measuring other indicators as well. So we won't find a one-to-one relationship in a country, in any country really, that wants to ensure that the SDGs are well tailored to their needs. Next slide. What types of data analyses are needed? Quantitative data should be analyzed regarding service coverage by types of population, service coverage again, but by types of services. In other words, are the services adequately provided in each region of the country? Are all populations being well served? We also study them by governance level, national or central, provincial, district, municipal, or community, depending upon how the country is organized. Gender, and this is where we find some very interesting results. In ECI, for example, we may find that boys are very much more served than girls. Why is this the case? Age levels served. Are we serving the 0 to 3 adequately? Or are we only addressing, or mainly addressing, children from 3 to 6? Have we included preconception and prenatal education and care? So we need to look at those aspects, and they aren't necessarily going to be found without additional study that we have found. Level and types of financial support need to be the study of the finances of the country. And then again, the cost per child, cohort, and program service by major types of services. Next slide, please. With regard to qualitative data, they should be analyzed at a minimum by the types of populations, ethnic groups, and income levels that are found. The types of roles, for example, directors of services, personnel, and beneficiaries. It's very interesting to compare and contrast the needs and interests of these different entities, different types of people, and secondly, to find out their recommendations. Sometimes they come together, sometimes they don't. Leadership roles in government are critically important. So we try to analyze at the national, provincial, district, and municipal levels. I like to think of it as in a vertical way, from bottom up. But I also like to analyze horizontally. Do we have similar responses across the different geographical areas? Next slide, please. In addition to policies, plans, and laws, what other types of ECD data needs exist? Annual national program and budgetary planning is often a year-long process. At least it's 9 months. And you don't hear about this nearly as much as you do the large policies, which tend to be from 0 to 5 years. What we find is that every country has to start very early in preparing its ECD budgets. So this annual national program and budget planning process is often somewhat untransparent. It's necessary to know exactly who is doing what with whom at what time in the year. So that becomes a very important part of our work. ECD monitoring and evaluation systems should produce annual reports. Again, these will be very necessary for planning ahead. When you plan ahead, you need 2 years. That already the first year has been planned. So then you need to plan ahead for the second year. And that way you can have a rolling and approach and a greater continuity of effort over time. So we recommend 2-year planning each year. Annual program expenditure analyses for major budgetary programs are conducted. What have we spent? Have we spent it fully? Have we spent it well? What are the outcomes? And the effectiveness of major programs in achieving their goals. That is still an aspiration in many countries. Next slide, please. Here you see two cycles. The first one is on the left, and you see you begin with situation analysis and research, planning and program and policy design, policy and program implementation, and there comes in monitoring and evaluation of how are we doing in all the respects mentioned and more, and reporting. And you will see a line that goes up to the right-hand cycle, which is monitoring and evaluation. And notice that it goes both ways. With regard to the monitoring and evaluation system, you have the design of the system, the collecting of data. There they go. The data go into management information systems. And in addition, we conduct surveys at that point for items that are especially national and are not already in other surveys. We have the analysis and interpretation of those results and the reporting once again, and then a reassessing of the monitoring and evaluation system and its contents. In actual fact, this slide does not really explain what happens. I think of this as a cycle, or rather 2 cycles. And every year you're cycling forward. You're never at the same place. History, quote unquote, intervenes, and you have suddenly a major concern because there's been a volcano erupting, you have acid rain, and the crops have been damaged, you have food problems, and the situation for children has worsened. In other cases, you may have a situation of a change of government, which will bring in other changes that are required. So look at that line that goes from monitoring and evaluation and up to monitoring. Think of the policy cycle on the left going through, and then within it, almost like a core, it's cycling. Monitoring and evaluation is cycling within it. I know it's a complex vision, but that's more or less what really happens. We're cycling forward with regard to policy, and we're cycling forward with regard to monitoring and evaluation. And hopefully we are meshing the two so that they're feeding to each other. Next slide, please. What collaborations already exist among ECD sectors that might help to develop multisectoral monitoring and evaluation systems? I tried to identify any other existing governmental systems that may exist, such as the National SDG effort or the National Development Plan, because it is truly multisectoral, and see what they did that was successful. I also look at other areas such as gender or youth that tend to be multisectoral and see if I can get any clues there on what works well. In some countries, we do have strong ECD organizational systems. In those countries, there is usually a national or central level ECD steering committee, a technical committee that sits under that one. The steering committee would be high level, either ministers or deputy ministers. The ECD technical committee would be high level department heads, people who really know the work inside out and backward, and an ECD office, which sits anywhere that you can imagine. They are found predominantly in education ministries, secondarily in health ministries, and also in social protection or social welfare ministries. I must tell you, though, that some of the most successful ones are in prime minister or presidential offices. And these are the motor for the whole system. At provincial levels, we have ECD provincial committees and offices, especially in large countries, but even in more medium-sized countries, you will find them. District level entities may take over the provincial level. It depends on what the configuration is in the country. And at the municipal level, using existing committees wherever we can, we have the ECD municipal level entities. And we try to identify all major national and provincial ECD systems and programs, and we ask if they have databases. Many times they do, because they are collecting data that are coming up from the various communities and municipalities. We also try to find, if we don't have some of those especially, but we try to find if there are ECD collaborations, such as ECD networks in the country. Sometimes they can be very strong and be developing their own statistical database. Coalitions are particularly strong, and associations. Next slide, please. So how to begin to develop a multisectoral ECD data system if none exists? Well, the first thing is to create a common vision for ECD. This is critically important. Many don't think of it, or they skip over it because they are thinking instrumentally of the various areas of content of ECD. But to build multisectorality, you have to build, or the people themselves have to build, a common vision for ECD. And once they do that, they realize they have to work together to achieve a whole of government approach. And this will lead to building an effective multisectoral collaboration, and also organizational frameworks. I try to identify key national decision makers and ECD leaders in all ECD sectors and interview them to find out about what they are doing and what types of indicators they might have that they're working with. I study other existing decentralized systems within the country. Say that you have a decentralized education program where the funds flow down to the provincial and then to the municipal level, or directly to the municipal level. That will give me clues about successful sectoral and multisectoral structures that may exist. And if one does not have a participatory ECD policy planning system, it's good to develop both the national ECD monitoring and evaluation system in tandem with the ECD policy planning, because when you do that, you have a strong base for moving on into the future. And Carlos will now take over the slides.
Thank you, Emily, and good morning, afternoon, everyone. I am very thankful and delighted to be here virtually with you to share my part of the presentation, which aims to provide some insights on how an integrated M&E monitoring system can be developed. So for the purpose of this presentation, I would like to answer the following 4 questions. So how does a country address comprehensive development? What services are available in the country to ensure the provision of ECD right-based interventions? What information systems and databases and surveys are available to track the delivery of ECD right-based interventions? And how to integrate information systems to monitor each child's access to ECD right-based interventions. So let's start. So the first question here is, how does a country address comprehensive development? And the first thing to consider here is to build a framework that integrates a whole child approach. And this might be obvious, however, it's not rare to observe in some countries that sectoral approaches are kept as a route to build ECD policies and frameworks. And here the nurturing care framework is a very good example among other frameworks of a whole child approach that provides a pathway for countries for ECD policy planning and addressing the comprehensive development of young children. This framework proposes a set of interventions for each of the components. So as you can see here in the components of opportunities for early learning, we have different interventions. These are just some examples of the ones included in the framework. For good health, we have another set of interventions. For adequate nutrition, we have another set of interventions, responsive caregiving, and security and safety. But what is very important to mention here and to note is that these interventions can be adjusted, prioritized, or expanded by countries depending on their own context. The second question that I would like to address is what services, so once we have this framework, the next question to answer is what services are available in the country to ensure the provision of ECD right-based interventions. And to answer these questions, I propose to establish a difference between a right-based intervention and a service. So a right-based interventions are not necessarily equal to a single service or program. And what is clear here is that one service or program can provide one or more interventions from different sectors. And let's see just some examples. So for example, these 2 interventions of the nurturing care framework, immunization for mothers and children, or growth monitor and promotion, can be provided by a child maternal health program. Another example could be these 3 interventions that encourage play and communications activities of caregivers with the child, good quality daycare for children and inclusive pre-primary education, and support for appropriate complementary feeding. And these 3 interventions can be provided by one service, which is inclusive childcare and education centers. And then another example is a cash or in-kind transfer that can be provided by a cash voucher assistance program, or finally, a birth registration, which is usually provided or issued by a civil registration and vital statistics systems. So moving forward, the following questions that I like to raise is regarding the availability of sectorial management information system to track the delivery of ECD interventions. And more specifically, it's very critical to ask if those information systems of those programs and services are including variables or database elements to track for each child the delivery of an interventions within the program or the service. So for example, so let's keep bringing the example of the previous slides. The child and maternal health program. The database of the information system is including variables regarding the assurance of immunization or the assistance of the children to growth, monitor, and promotion. The information system of inclusive childcare and education center is including variables regarding the attendance of children to the childcare and education center, or another variable regarding the caregivers' attendance in to the parenting sessions. And finally, we have the cash voucher assistance program. And the question here, if the information system is capturing, including a variable to capture the information on whether the child family received the voucher, but it's also important that this voucher or cash transfer is usually conditioned by the attendance of children, for example, to immunization or to a childcare education center. And here, what is also critical to note is that the child birth registration number or identification number or civil identification number should be included as a mandatory variable in all database variables, because this number will be the one that will help us to bring together and cross the data between the different information systems. So the next question is how to track the status of each child from a holistic approach regarding access to these key interventions. So the challenge here would be to integrate sectorial management information systems to be able to report on individual children from the local to national levels using a unique identifying number. So this is the most important challenge. And this is just an example of 3 different sectoral databases of information systems that should be integrated. And this approach will support planning and implementing using a population and geographic approach. So looking again at our example, we can raise 2 questions. So regarding the 6 interventions that we have been looking for. Is one child accessing to all ECD right-based interventions? And the second question is, what can the ECD system do to ensure the child's access to missing interventions? So now I wish to share with you an example of how a country worked to define its policy and how they did to define address comprehensive development and how information systems were integrated to individually track each child. So back in 2012, when Colombia started the ECD policy from zero to forever, one of the first steps was to define a comprehensive set of interventions that should be delivered to pregnant women, families, and children. And out of this set of interventions, they decided to prioritize 8 interventions. So these are the ones that you see for 2013. And this decision, this is very important, was based on 2 aspects. On one hand, the capacity of the country to deliver those interventions through existing services and programs. And second, the capacity of the country and the programs and the sectors to monitor those interventions. So we had 8 interventions in 2013, and then in 2013, and then in 2018, they added 5 additional interventions to track. So to track these interventions, the ECD policy through the Ministry of Education designed the ECD monitoring system. And this system is led by the Ministry of Education. So how the system works in integrating different databases from different sectors. And keep this key in mind, which is the birth registration number. So First, we have a set of information systems that includes information on early education and preschool information. So we have the database from the Colombian Institute for Family Welfare, the education information system from the Ministry of Education, the early education and care information system by the Bogota Secretary of Social Integration, and then we have family welfare corporations that also provides information. So all this information is sent to the Ministry of Education, and they integrate the list of children accessing to education and care and preschool services, and they also integrate the information on access to books, pedagogical resources, parenting, plus feeding. So all these interventions are related to the previous slide. The next database that is integrated in these ECD monitoring systems are the Families in Action Conditional Cash Transfer Program by the Department for Social Prosperity. So they sent the information to the ministry of the list of children whose family are receiving conditional cash transfers. Then we have another 3 sets of lists that comes from the health sector. So we have the health and social security system, the children that are registered into this system, and this information is sent by the Ministry of Health and Social Protection. Then we have the database of the National Vaccination Program, so they sent the information of children that are being vaccinated. And finally, the ministry also sends the information of children that attends to monitoring and promotion services through the individual registration of health services information system. And finally, and this is a system that is currently being developed, is the Ministry of Sports, who sends the data also of children that participate in recreation services. So all this data is included in one database, or let's say one information system. And this system, as for today, has 2.8 million children registered into the system, younger than 5 years, from 0 to 5 years, sorry, out of the total population of 0 to 5 years in Colombia, which is 4.6. That means that the system currently has around 60% of the information of the total children 0 to 5 years in Colombia. And the system provides 2 different types of reports. First, aggregated reports on access to ECD interventions, and secondly, and most importantly, they produce information or alerts for each child that has missing interventions. So let's see an example of how the information looks like. So again, out of 2 million children included in the monitoring system, what we can see here, and this is what the system calls, is that they receive, let's say, they have comprehensive development, of they are receiving the set of comprehensive interventions if they have at least 6 out of the 13 interventions that were prioritized, the ones I showed you. So here, what the system shows currently is that out of the 2.8 million, 56% children receive at least 6 of the total prioritized interventions, and average of 5.3 interventions received. So here you can see where most of the interventions. So what it means here is that at least 588,000 children, 588,000 children are receiving at the same time 7 interventions. And this is the example for each of the bars. You filter the information, for example, for migrant children, what you will see is that the situation changes. So here what we have is that out of 160,000 migrant children included into the system, only 8% of them receive at least 6 prioritize interventions with an average of 2-point interventions. So here you can see in the graph above is that most of the population is between 3 and 8 interventions at the same time. But here, let's say the graph moves to the left. And this is very important because this provides critical information for the government to start targeting migrant children and start working with their families to ensure that all these children start receiving more and more interventions at the same time, and start moving this graph to the right. That's what we want. Yeah. And the next type of report that you can see is like the coverage of each intervention. So these are the list of the interventions. And here is what you can see here is that 83% of the children included in the system are registered to the healthcare system. I don't know, for example, 94% have a civil registration certificate, 61% are fully vaccinated according to schedule, and so on. But again, what is most important here is to use this system to produce alerts at the local level, organize the ECD system at the local level and the organizations, both public and private, that are part of the policy, and ensure that they all work together to ensure each child is receiving the missing interventions. So this is, at the end, this is what the country wants to ensure with this information system. I leave my presentation here and I will give the floor to Crystal. Thank you very much.
Thank you, Carlos. And hello to everyone all over the world. I'm going to talk about the organizational structures required for successful M&E systems. As you could see from Emily's and Carlos' interventions, M&E systems are quite complex, and therefore they need many special structural organizations to work successfully. Next slide, please. To implement a multisectoral M&E systems requires official interinstitutional structures and agreements. These structures and agreements are necessary because ECD M&E systems entail multisectoral data sharing. We need data from all sectors, and for that we need some type of structures and organizations to do it successfully. There is also the need for horizontal and vertical collaboration for the creation of the information system and the multisectoral database. Also, because governments and personnel change over time, it is important to establish organizational structures and official agreements among the ministries, offices, and agencies in order to ensure the sustainability of the system. These agreements and structures are also useful to achieve quality assurance and to establish clear implementation plans and rules for managing the ECD and ECI M&E systems. Also, of course, for producing the integrated and multisectoral ECD reports. Next slide, please. Here we can see what an M&E system within an ECD organizational structure can look like. We have 4 levels, from a high-level entity to the MIS offices in ministries. There is also, we need to keep in mind that there is also data sharing from the local level in the country to the national level. In addition, in many cases, private and civil society actors are involved in ECD service delivery and funding, so we need to incorporate them into the structure. Therefore, coordination, data sharing, and reporting between all these actors will be crucial to enabling effective monitoring of ECD. Next slide, please. The first level, the high level, it's a ECD coordination body that can be called the ECD Steering Committee, or in some other countries, ECD National Councils. And it should be composed by high-level officials such as ECD ministers and directors of leading civil society and private sectors agencies. The ECD Steering Committee manages primarily the political strategies and guidelines. It establishes common goals across the sectors. It relates the ECD policy to other national policies, acknowledging the limitations and the opportunities in all of them. It ensures that the ECD policy will be well aligned with the action plan, as well as with the regional and international ECD frameworks, and of course to the SDG framework. The steering committee receives and reviews the reports, makes decisions, and gives instructions. It prepares annual plans and budgets, and also the annual plans for policy advocacy and social communication. In different countries, and experiences in different countries have shown that an implementing agency is more successful if it is located close to the seat of the government power, has strong convening ability, and is led by a person with leadership abilities, strong organizational coordination, and negotiation skills. The ECD steering committee should hold a minimum of 2 meetings per year, in addition to the occasional extraordinary meeting called to address specific and pressing issues. Next slide, please. The second level is an ECD technical committee, such as the ECD task force or the ECD technical working group. This group or this committee, the purpose or their roles is to ensure the ECD policies and action plans are well implemented, and to ensure that there is no duplication of tasks, and a good articulation of mandates and goals across different sectors and institutions involved in the provision of ECD services. This group also provides timely information and updates on ECD to the steering committee, to the government at all levels, and to the nation as a whole. This group also guides and supports efforts to ECD workforce development and capacity building. It's very important in many, many countries. It also supervises the monitoring and evaluation and the progress of the strategic objectives of the ECD policy of the country. The technical working group should meet regularly. It should involve representatives from the Ministry of Education, of Health, of Social Development, and all possible sectors. Financing is also very important to include in this group, as well as relevant international and local civil society organizations. Next slide, please. The entity implementing the ECD M&E framework is the ECD M&E Coordination Committee. It manages, facilitates, and coordinates the monitoring and evaluation system. It is responsible for the technical features of the M&E framework. It defines and adjusts the M&E operational guidelines, conducts data planning, works closely with each ministry's office, unit, or representative designated to support the implementation of the M&E framework. It analyzes and interprets data collected by each ministry's MIS office, and produces reports for the coordination of the ECD technical working group and the steering committee. In addition to having a representative from all sectors and ministries, it is important to include representatives of major ECD programs in the country. The ECD M&E Coordination Committee should meet quarterly. It's needless to say, this operational and technical entity is indispensable for the success of the M&E system. Next slide, please. The fourth level is constituted by the offices in ministries that work with relevant statistics, the MIS of education, health, social development, protection, etc. And also participation of the National Department of Statistics or the Bureau of Statistics, depending on what there is in each country. Ideally, a specific office of unit for ECD will be established in each ministry to support the work of the ECD M&E Coordination Committee, or a representative from each MIS office will be assigned to support the work of the ECD M&E Coordination Committee. These units will collect and share all the ECD data with the M&E Coordination Committee. It is important to note that the ECD M&E Committee should receive support from the Management Information System from each ministry, as well, and this is very important, from representatives from ECD programs, because these the programs and the service providers of ECD services are the ones that know the status of ECD service provision, where are the gaps, where are the needs. So it's these two different types of information, the numbers, the statistics, and the ECD programs need to feed this system. Next slide, please. This is another way to illustrate the organizational M&E structure. We see in this table the 4 levels in the rows, and in the structure, the first column are the entities. The leadership of each entity is in the second column. Is for the ECD steering committee. Depending on the country, it can be nested in different places. In some countries, the ECD steering committee is within the prime minister's offices. Other countries have the steering committee located in one of the ministry. As Emily mentioned before, education is the most used. Or other countries use like an interagency office. The implementing agency is sometimes a semi-autonomous agency, like the case in Colombia, which is like a executive agency close to the president. Next slide, please. While establishing the structure for the M&E system, many challenges may emerge, and it is very important to have them into consideration while planning the system, so we can address them in a timely manner. These are the most common challenges. The first is the lack of an adequate infrastructure in place to support the coordination and across sectors. It is important to say also that when building the system, it is very advisable to use the existing structures already in place in the country and using the resources that are already in place, rather than creating new offices or new structures. Another challenge is the difficulty in aligning different initiatives from health, education, nutrition, from different programs and policies around common goals. Difficulty in finding adequate funding for ECD services, this is common. Inadequate training and monitoring and evaluation concepts and techniques for ECD professionals, and unclear roles and responsibilities for ECD implementation plan. And that brings me to my next slide, which is explains the official interinstitutional agreements and their importance in the construction of the M&E system. To ensure that a well-functioning M&E system, it is critical that it is giving a clear mandate and it has well-defined rules and protocols. Formal agreements such as a memorandum of understanding, written and signed, are recommended because when leadership changes, informal agreements may not be honored. So these official interinstitutional agreements are fundamental to the sustainability also of the system. These agreements should provide a common vision and goals, uniting all sectors to serve children. They should assign and clearly state the roles and responsibilities of the personnel. They should describe how to gather, collate, analyze, and share data. They should ensure multisectoral data sharing to the ECD database. They should include stakeholders from each sector and from all different levels. They designate frequency, periodicity, and protocols for regular meetings among committees. They should also explain how indicators are linked to services and to the ECD policy, and how additional indicators should be included when the system is ready to scale up. They should describe the procedures for analyzing, reporting, and the distribution of those special reports for policy, program, and budgetary planning purposes. These agreements also enable the quality assurance and they guarantee the accountability of the M&E system. And of course, they should describe the type of reports and their application. Next slide, please. It is also critical to ensure that the M&E system is successful. It is critical that it be provided with adequate resources, financial and human capital to fulfill its mandate. And it is important that it be afforded the power and the influence necessary to make policy and funding decisions. A critical factor for the success of any M&E system is to ensure that children's needs are addressed by building a strong and coordinated ECD system. And thank you very, very much for your attention and for your time. I guess it's time for if you have questions or if you want to discuss any particular topic, we are opening the floor for that.
Thank you so much to all of the speakers. I do see there is two questions, one in the chat and one in the Q&A, both related to the example that was given from Colombia. So those may be for Carlos to respond. So maybe we can start with those. And please, if you do have questions or comments, feel free to either use the chat, the Q&A function. You can also raise your hand and we can unmute you so that you could also speak as well. So the two questions we had related to the Colombia example, the first question was asking whether 6 interventions out of 13 is sufficient to ensure a minimum level of comprehensive development. And then the second question that we had in related to Colombia was whether or why all children are not included in the integrated ECD information management system. And another question also just popped up related to Colombia, which was why the M&E system, and I think this is the same question, so why the M&E system in Colombia does not cover all children under the age of 5. So maybe I can give the floor to Carlos to respond.
Sure, Nicole. Thank you very much, and thank you for your questions. So I will start with the last 2 questions, which is the same. So the thing here is that when they started to build the system, the decision that was taken at that moment is that let's say, like the door of entry of the data into the system, were the children that were attending to early childhood and education services, and then they added the information of children that were attending to preschool services. So in a way, this is the point of entry, let's say, of children to the information system. So that means that only 60, not only, actually the rate is very high. 60% of the children that are covered by the system is the 60% that actually covered by the early education and care services and preschool services in Colombia. That's why the system doesn't cover more children. So the higher it goes, let's say the coverage of early childhood care and education services, the higher, let's say, the coverage will be. We have the system, the money system for that will be included into the system. So that's one part of the question. And I want to make a difference here. For example, the system that was built by Chile, for example, the door of entry of the children into the system was the children that were accessing to the health to the health services. So the coverage of the system will be different than the one from Colombia, because the point of entry in this case will be the health system and not the education and welfare system. That's, I think, the difference, and I think it will be very interesting at some point to get a better, a more in-depth explanation of both information system at some stage. And regarding the other question, are 6 interventions enough out of 13 to ensure minimum level of comprehensive development? I guess no. The idea would be to receive more interventions, but the decision here is that the 6 are like the minimum out of the 13 that the country seeks to ensure and to track. Yeah, and these 6, for example, they started with a lower number at the beginning. When they were only 8 interventions, they had a lower number, and now that they have 13, they have 6, and this will be the idea is to start increasing the number of intervention, and this gives also the idea that the system is an evolving system. As it strengthens, as it becomes more strengthened, the system will be capable to track more and more interventions, and also the system also will be available, will be capable of delivering more and more interventions. So it's a balance between both. Thank you.
Thanks, Carlos. I think there was one other question, which I do believe you maybe addressed during your presentation, but again, in relation to the Colombia example, someone was asking when the system started and how long it took to establish it. So maybe if you could just restate that piece of information as well.
Sure. So it started in 2012. Like, we started thinking about the system, but actually the first implementation was later in 2014, and we started very like with the small pilots, crossing the data from different sectors until we and then the Ministry of Education actually contracted a firm to build a proper system to receive and to host all the data coming from the different information system, and started being implemented around 2014-15, like the first production of data. But it was a long process. It takes time, because also it takes time to strengthen the other information system to produce the data that the system required.
Great. So we have a question, and I'm not sure which of the three of you are all of you can respond on from RT was asking how to prioritize interventions. And is there a comprehensive evidence base available or guidance on selection of interventions which are fit for purpose for a country context? So I'm not sure which of the three of you would like to tackle that one.
It's a very difficult one, and it will differ from country to country. It's a question of country prioritization. A lot of people think that we can work only from an evidence base. You have to work in addition to that, to the political will and emphases within each country, so that it's a balance between what research might tell us and what politics and policy tell us. So we have to address the key questions. Fortunately, in most cases, people dealing with early childhood development policy planning are very open to considering the different options and choose quite wisely. The countries where we have difficulty are countries where there are authoritarian systems and there is less interest in addressing children's issues, basically. But it depends on the country. In Colombia, this system really has its antecedents way back over a long period of years, but it developed to a point where it became possible to do a full child tracking system. Many countries do not begin with a full child tracking system. They begin with systems of selected indicators and move from that as they gain a better hold on their birth registration and create unique numbers. They then can begin to move to a child tracking system. There was an interesting question about how long it takes to set up a system well and really have the essential ingredients that Crystal and Carlos presented. Takes about a year, but it has to be developed in phases. You start small, you build it over time. Based on practice, experience, and how systems work, you then improve and improve on the system over time. So it isn't something that's done in a day. I would say for a fairly mature system, it would take at least 5 years. But certainly you can get the basics of the system up within a year. I don't know, do Crystal and Carlos agree on that point?
Yes, and I will also emphasize that you start with what there is.
Mhm.
You don't start trying to build something completely from scratch and from anew, because it will take more resources and it will upset in a way the people of the country. I mean, you need to build from what there is, and as well, you prioritize the indicators according to the country, as Emily was explaining. You are building the system with the resources that are already in place, the offices that are already in place in the country. So no country will build the system identically, because each country has their own characteristics and their own structures already in place.
Nicole, there's an interesting question, excuse me, from Evelyn Sherrill, when she says, can you address any early identification systems related to high-risk registries and or newborn screening, if underway? And are these integrated with MCH and ECD databases? Yes and no. We know how to do it. Some of that is in place actually in the United States, where we do have some high-risk registries, but they have never become national, fully national. You have the ECDAC work, as you know. There's a great deal that's underway now in design regarding children, for example, with newborn screening identification, with all the careful attention to a combination of research ethics and individual privacy rights, family privacy rights, child privacy rights. And in that, the Europeans are doing very, very well with the EU system of GDPR. I think that this is a growing area. It is absolutely essential for early childhood intervention programs. And thank you very much for asking, because I would like to see a tremendous emphasis on this in the coming 5 years. I feel that this is the really most critical area where we can help and to support families with children that are fragile from the very beginning. And we would like to see that happen everywhere.
If I may add something here, and I think is very important, is I think one of the most important challenges that at least Colombia has faced in integrating data systems is the integration of systems related to children that have been victims of abuse, neglect, or because that data usually has like privacy use, and it's very difficult to share that data that usually comes from the child protection sector or the welfare sector with the other sectors. So I think that part is very challenging. We still face that challenge to integrate the data. We have been able to integrate data from the database of the system that has information on people that have been victims of the armed conflict in Colombia. That one is already integrated into this database, but the data from the child protection sector hasn't been integrated into the system. So I think that's an important challenge that maybe countries will face when integrated data into a system. Over.
That's actually a great segue, and maybe a little teaser for one topic that we're exploring. A potential webinar for next year is looking at responsible data for children and the principles that have been developed by UNICEF and how you integrate and address these principles around responsible data for children really from the outset when planning an integrated M&E system. So stay tuned, because that's coming up as part of the webinar series as part of next year. I think I saw another question in the Q&A, although I'm not sure I fully understand, but I think this person is asking about the effects that have been observed with, I guess, this work around the integrated M&E systems, or how you've seen what some of the effects maybe have been, for instance, in Colombia. So I don't know which of you would like to try to address that.
Carlos?
Effects on children or the system? Because
maybe both.
the system, what the system shows at the moment is that it has been very useful, as I mentioned at the beginning. The main purpose of the system is to produce alerts for each child. So when we find that a child has only 2 right-based interventions, how the system can work together with the public and private organizations to get that child from 2 interventions to 6 to 7. I think that's one of the most important purposes of not one of the most important, the most important purpose of the system. And what you can see in the system is that basically the children that have been included into the database, with the time, the number of interventions that are ensured at the same time are getting higher and higher. That means that the system is having the results that it seeks to have. So I think that's one of the most important effects on the children. It's important to mention that the children is not tracking the development of children. That's another tools, and that's another type of discussion. But another effect which is important, I think, is that it's showing somehow to the country that it's possible to track children, individual children, and that's I think that's an important achievement of the system itself. Because usually it's not normal that when you start and when we started dreaming about this system, we say, no, we cannot put together the database of health plus education. That's not possible, but it was possible. So I think that's an important achievement of the system itself for the policy.
Which, by the way, brings up the importance of building a strong birth registration system with individual identifying numbers. This is absolutely critical for the future in every country. And in some countries, we still have very low birth registration. That should be attacked very straightforwardly in all countries where this is the case. And building upon that, the database can grow over time. There's also a comment in here, a rather long and important one from Javier Sáenz Corre of Argentina, and it's in Spanish, and I'm wishing that it were in English for everyone. But I think that he made a lot of very important points having to do with the importance of addressing the children's needs. And I leave it at that, simply to recognize and thank Javier for his addition.
Thank you. Is there any, we have a couple more minutes, so just, is there any further questions or comments from any participants before we close the webinar? Or please also, you can raise your hand and we can unmute you if you'd like to speak. Otherwise, I'll just, excuse me, mention again that this will be the last webinar in the series for this year. We're putting together again a calendar of topics and dates for webinars next year. Some of the topics we're already identifying and exploring include one on, the nurturing care framework. We're looking at having a webinar about the ongoing harmonization work between UNICEF and WHO on measurement of ECD for children under the age of 2. And as I mentioned, also one on looking at responsible data for children and how to plan for this as part of integrated multisectoral M&E systems. So please do, if you have topics that you would like to suggest, or propose, we are more than open to hearing from everyone. And so please do feel free to reach out either us at UNICEF or to the RISE team. And we would facilitate and support with the logistics of planning the webinar. And we're very much welcome suggestions for other topics for next year. I see there's another question, and maybe this can be the last one before we close the webinar. So I see there's another question from Mustafa asking about how to collect information for services that are provided by non-state stakeholders and non-state actors.
We routinely include the presence of non-state actors. It sounds like a terrible term, non-state, but what we mean are non-governmental organizations, civil society organizations, faith-based organizations, community-based organizations, and sometimes private entities, although that tends not to be the case because of the question of charging of fees and the exclusion to access for people. So we tend to work with the broadly stated nonprofit sector in countries. Many of these organizations are very large. Some are international NGOs with national expression, and they provide tremendous leadership in their countries and oftentimes are absolutely key in achieving the goals of the government. The government counts on them, contracts with them, and supports them in their work. This often happens in early childhood intervention, where we find that NGOs perform a lot of other services in countries. Thus, it becomes extremely important that they be included fully from the beginning. And perhaps we didn't emphasize that enough in our discussion. I saw it in different points, but to me, this is always a collaborative process between the civil society sector and the governmental sector.
One thing which is very important also is that the licensing requirements of those private organizations should be attached to reporting information to the government. That's something which is critical, because what we often see, and this is usually happens in the field of early education and care, mostly in the welfare sector, is that the private organizations are like scattered and loosed from the hands, let's say, of the government. But usually the government provides a licensing or a permit to for them to operate, and that license should be attached to the provision of the information of the children of each child that is attending to the centers. And that legal framework can be very powerful to start bringing the information of the non-governmental organizations that usually are part of the system. So that's a recommendation that we would mention. Thank you.
In line with that, also the indicators that are going to be used across projects working in the same areas or similar areas that are inputs, outputs, and outcomes, especially the outcomes. They become critically important. And if you can create the system from the very beginning where the requirements of certain indicators to be captured within particular programs or institutions, organizations that are aligned with national indicators on the same areas, you have a very strong system. But again, that takes purposeful planning, various types of monitoring and evaluation manuals, instrumentation, clear specification of the measures that are used, and finally, a consistent system of database provision, in other words, of sending data to a database and data analysis. So it sounds complex, but in actual fact, with good planning, it becomes fairly routine rather quickly.
Great. Is there any final comments or reflections from any of the panelists?
Crystal?
No, it was a pleasure to be part of the webinar, and I'm looking forward for the next year's webinar.
Carlos?
Same here. It was a pleasure sharing today, and looking forward to learning more from next year webinars. So thank you very much.
I also thank everyone and simply want to say that if you have any questions that you didn't quite get onto the question and answer section, please feel free to contact us. We would be delighted to try to support you in any way possible with an idea here or a suggestion there. So thank you for attending, and I hope it was interesting and I hope it was helpful.
And I also, on behalf of UNICEF, thank everyone for attending, and to the panelists as well. And again, we will be sending out an outreach email at a later stage with the calendar of topics and dates for the webinar series in 2023. So look out for that. And thank you everyone for participating. Take care. Goodbye.
Bye-bye.
Bye.